Open the flap after incising and detaching the soft tissue to see where the fixture is placed. The attached gingiva should be preserved at the time of incision, and the infected tissue should be removed as well. The point drill's uniquely pointed tip with laser markings facilitates drilling position and initial drilling. In order to prevent bone heating caused by drilling, use it at 800 to 1200 RPM with irrigation. The path drill is selectively used by the surgeon's decision in case that path modification is required during drilling. And drill by checking the laser markings according to the length of the fixture. The initial drill widens the hole formed by the point drill to 2.2 to 3.3 millimeters. The path cutter with 2.2 millimeters in diameter of the initial drill determines the orientation of fixture placement. The 4 millimeter long steeped pilot cutter with 2.8 and 3.3 millimeter in diameter ensures that the final drills are seated correctly and maintain the drilling direction accurately when the final drills are inserted. The crestal cutter with 4.9 millimeter in diameter flattens sloped and sharp crestal ridge to form the final implantation length. The parallel pin is used to predict the angle and pathway of the fixture and to see if correction needs to be made. The part with 2.2 millimeter in diameter is used after initial drilling, and the other part is used after final drilling. In order to prevent losing the parallel pin in patient's mouth, make sure to tie floss through the hole of the parallel pin. The left part with DP marked on it is to measure the drilling depth, and the right part with GH marked on it is to measure the gingival height. The length of the final drill is distinguished by the color band, and choose the drill according to dimension of the fixture. And drill at 800 to 1200 RPM pumping action with enough irrigation to prevent overheating of the contact area. Countersink is selectively used when the bone quality of the cortical bone is D1 or D2 to reduce insertion torque value. In case of D2, drill until the lower marking, and in case of D1, drill until the upper marking. The tap drill is an optional product which is not included in the kit and is selectively used for D1 cortical bone quality. The distance of laser markings is 2 millimeters. Drill up to each marking according to the fixture length at 25 to 35 RPM with the placement mode set while tapping and convert to the reverse mode when removing the tap drill. Remove the ampule cap and connect the fixture with the fixture driver. The fixture and fixture driver should be completely fastened. Slowly start placing the fixture at 25 to 35 RPM. Recommended final torque is 35 to 50 Newton centimeter. To control the torque and fixture placement, connect the fixture driver for ratchet to the fixture, then transfer the torque wrench. The torque force 10, 25, 30, and 35 Newton centimeter can be controlled by pulling the elastic bar, and maximal torque force 120 Newton centimeter can be reached by pulling the rigid main bar. Separate the upper part of the ampule and connect the cover screw with the hex driver. Dentists should be careful to prevent patient from swallowing the cover screw at the time of placing. After connecting the cover screw, suture with silk.